Welcome to National General Accident Health's Dental PPO product video. In this video, we're going to go over the product's plan design, the eligibility behind the dental PPO, how to enroll into this product, and any post-sale information either you or your client may need after the product is purchased. So why dental? Well, healthy teeth lower the overall healthcare expenses. It helps catch small problems before they become big expenses. More than 1 in 4, so 27% of adults in the United States have untreated tooth decay, and nearly half, 46%, of all adults aged 30 or older show signs of gum disease, and severe gum disease affects 9% of adults. National General's Dental PPO has 3 plan levels: Essentials, Essentials Plus, and Enhance. It uses the Carrington Maximum Care Dental Network and comes with a Life Association membership. Here's a layout of the dental PPO's plan benefits. Across the top are the plans, and down the left-hand side are the benefits. All plans have the same annual deductible for individual or family. The deductible does not apply to preventive services, but the deductible will have to be satisfied before the plan starts paying benefits for basic or major services. All plans pay preventive dental services at 100%. Those are things like cleanings and x-rays. The Essentials and Essentials Plus have a 70% coinsurance for basic services, leaving your client responsible for only 30% of basic services. These are services like consultations, extractions, and fillings. Only the Essentials Plus and Enhanced plan provides benefits for major services. The Essentials Plus at 25% and the Enhanced at 50%. If major services are important to your client, the Enhanced plan would be the best option. Each plan has annual maximum benefits, which is how much the plans will pay out in benefits per person per year. The Essentials is $1,000, the Essentials Plus is $1,250, and the Enhanced is $2,000. The nice thing about these plans is that there's no waiting period for your client to use their preventive benefits, and only a 6-month wait on their basic. Since only the Essentials Plus and Enhanced provide benefits for major services, they're the only plans with a 12-month wait on major services and an 18-month wait on dentures. Preventive benefits are things such as evaluations, cleanings, and x-rays. Basic benefits would be emergency treatment of dental pain, consultations, denture adjustments and repairs or extractions, and in the major services, it'd be deep sedation, general anesthesia for major services, crowns, single restoration only, endodontics, or dentures. National General's Dental PPO uses the Carrington Maximum Care Dental Network, which is a combination of Care PPO, Care Platinum PPO, and DentiMax providers. Their goal is to make a strong neighborly dental network. The Carrington Maximum Care Dental Network has over 200,000 dental practices and average savings of 42% when customers use network providers. It may provide savings on routine oral exams, cleanings, major work. Discounts may apply on services not covered by the plan and on services provided during the benefit waiting period when the clients use the network providers. Here's a preventive benefits example. This is based off the Enhanced plan. If preventive benefits of cleaning, evaluation, and x-rays comes to $191, and the cost after the network discount is $122 because the client stayed in the Carrington Maximum Care Dental Network, on this plan the coinsurance pays 100%, so the client's responsibility would be $0. Keep in mind, preventive benefits do not take away from the annual maximum benefit amount. If the client needed a filling, which is a basic benefit, and the cost of the filling is $198, if they stay in network, the cost after network discount is $136. The client would pay the deductible of $50, and then the plan's coinsurance starts paying in of $68.80. The customer's responsibility here on a $198 filling would be $67.20, and that's including the $50 deductible. For a major benefit example, again, this is based off the Enhanced plan. Let's say the client needed a crown, and the cost of the crown is $1,068. Cost after the network discount is $721, and the client pays their $50 deductible. Then the coinsurance starts paying in at 50%, so $335.50. The customer's responsibility, including the $50 deductible, on a $1,068 crown would be $385.50. The dental PPO plan comes with a life association, and that's a nonprofit, members-only organization which provides lifestyle-related benefits and discounts to its members. The association membership provides your client with access to special privileges and savings that can positively impact their day-to-day lives, on top of the dental benefits they receive from this PPO plan. There are healthcare benefits like senior medical alert discounts, monthly e-healthcare newsletter, an Amplifone hearing program, family benefits like auto service savings, wholesale club membership discounts, and student grant locator service, as well as entertainment savings like travel services, travel insurance, and dining and entertainment discounts. The dental PPO is available on the states on your screen. This plan can be sold to clients up to age 75, so through 74, and it renews up to age 85, so through 84. There are no child-only plans, and the plan is guaranteed issue, so there are no medical questions to answer. There are some exclusions on this dental product, such as procedures before the effective date, dental professionals, cosmetic surgery, orthodontics, services performed outside the United States, its territories in Canada, and military service members. This is not a complete list of limitations and exclusions. You can always refer to the brochure for a more comprehensive list, but always refer to the policy contract for a complete listing. The dental PPO effective date can be as early as the next day. The initial payment is drawn at time of application, so when you press submit, the payment is processed. Reoccurring payments are 5 days before the monthly anniversary of the effective date, and the acceptable forms of payment are EFT, checking and savings accounts, as well as Visa, MasterCard, or Discover. When enrolling into any plans from National General Accident and Health, your client must do a final attestation. You have two options to help your client attest to their plan: e-signature or voice verification. E-signature is by far the easiest. When you press submit on the application, your client will receive an email. This email will ask your client to create an account on the member portal, VIPmemberbenefits.com. And from there, they'll be prompted to read the authorizations and e-sign their policy. This takes just a few minutes. With voice signature, it takes a bit more time. The instructions for voice signature will be presented at the end of every application, and the steps need to be followed exactly as presented. You, with your client on the line, will dial into the voice signature line, read the authorizations, and have your client agree. The recording is kept as verification of agreement to enroll. E-signature is much easier, but the voice signature option is there if needed. Your client will have access to the member portal, VIPmemberbenefits.com, where they can view all their policy documents and change payment types for each policy they have with National General Accident and Health. National General has a great member services department that can help with policy changes during the free look period or change name or address on the policy at any time. They can also help with cancellations, but note, your client would need to cancel their plan 10 days before the next draft date. The dental PPO is a great addition to your portfolio and helpful to your clients because it has 3 benefit levels, and there are benefits available for major services. It uses the Carrington Maximum Care Dental Network, and there's over 200,000 dental practices in network. If you have any questions on any National General product or how to become appointed with National General, please contact the email address on your screen. Thanks for your time.